Hello guys, I'm Sony. So today I'm going to tell about the meningitis. 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 This is the structure of brain. So meningitis. You can see definition of meningitis. So meningitis. It is an inflammation and infection of the meninges. That is the protective covering of the brain and spinal cord. So meningitis is the infection and inflammation of the meninges. What is meninges? So here I have written meninges is the protective covering of the brain and spinal cord. After that, brain. So there are three layers in our brain, that is dura mater, arachnoid mater and pia mater. So dura mater, it is the outer layer of the brain. Then arachnoid mater, this is middle layer of the brain, and pia mater, it is the innermost layer of the brain. So after that I am going to tell about the causes of meningitis. So you can see here causes of meningitis. So causes of meningitis, that is, it is caused due to bacteria, virus and fungi. So after this I am going to tell about the classification of meningitis. So classification of meningitis. So meningitis is classified into three types, that is bacterial meningitis, aseptic meningitis and tuberculin meningitis. So bacterial meningitis, it is caused due to meningococcal bacteria, and aseptic, that means it is caused due to virus, fungi and protozoa. Then tuberculin meningitis, it is caused due to Mycobacterium tuberculosis. So after that I am going to tell about sign and symptoms of meningitis. So you can see I have made flashcard. So sign and symptoms of meningitis, that is headache, fever and confusion, drowsiness, then stiff neck and seizures. After that, two confirmative signs present in meningitis, that is positive Kernicks and Brudzinski sign. After that I am going to tell about the management of meningitis. In this management of meningitis, in which we have provided the symptomatic treatment, that means based on the symptoms of a person. Like if the patient is suffering from headache, then we have provided the headache or fever, then we have provided the patient analgesic or antipyretic medicine. If the patient is having increased intracranial pressure, then we have provided the patient mannitol. The dose of the mannitol in children, that is 0.05 mg per year. If the patient is having seizure, then we have provided to patient anticonvulsants to the patient. Anticonvulsants medicine, that is Dilatin and Diazepam. Dose of these medications, that is 2.5 mg in children. After that I am going to tell about the role of nurse in meningitis. Role of nurse in meningitis, that is nurse should have to identify the patient correctly, then assess the physical examination, especially neurological system, then after that administer medication to the patient, with right time, right dose and right route. Then provide proper rest to the patient. If the patient is suffering from photophobia, then we have avoid bright light to the patient. If the patient is having seizure, then don't restrict the patient. After that, I am going to tell about the prevention of meningitis. So, prevention of meningitis, in which we have provide the patient hip vaccine. Hip vaccine, that is Haemophilus influenza type B vaccination, that prevent against the meningitis. Thank you for my watching video.